more on this, we're joined by Reinhart. He's a medical anthropologist and resident physician at the psychiatry department at Northwestern University. Thank you so much for joining us on the program, sir. Now, looking at how the World Health Organization dealt with the pandemic, especially in the beginning when COVID first started to spread, how would you change their action plan?
I think I'd go back much further than when the pandemic began. All the conversation now is about vaccine distribution, and this is obviously incredibly important. And it's a remarkable failure, as was just said in the introduction here, that the world, that the wealthy nations of Europe and the US have failed to distribute the vaccine, to waive IP restrictions so that it can be produced and manufactured in places like Brazil and India that have the capacity to do this, delaying vaccine distribution. But I think the most important issue that is often lost in conversations that attend to the crisis of the moment are the historical and economic conditions that we have allowed to fester that produce these kinds of risks now. So there's a huge proportion of the global population that does not have access to basic primary care. The paradigm for biosecurity, for pandemic preparedness that has ruled in the world to this point has been one of containment. It's not built around prevention. Truly, it's built around prevention of the spread of deadly viruses, of deadly infections to wealthy parts of the world. So take the Ebola outbreak in West Africa and Central Africa, the outbreaks of the last decade. The predominant response has been to quarantine, to establish systems of containment. And this is obviously very important. There's a place for quarantine, there's a place for containment. But it's very difficult to establish effective quarantine or effective containment strategies when the population you're working with do not trust that you'll provide care. And this, I think, is the biggest deficit that we should be looking at. Why have built a global health system that is organized around containment rather than around the provision of care? These two things have to go together. If we invest only in containment and surveillance systems, essentially policing systems, rather than care and security, we will perpetually be putting ourselves at risk like this, because you cannot rely simply upon containment. Not only is it not ethical.
Can we overcome this virus when very populated parts of the world, as you mentioned, does not have access to vials?
You know, early in the pandemic, you can look at Vietnam, South Korea. You had exceptionally good control of the virus without a vaccine available. You had effective systems of centralized governance that people trusted and that were very effective at preventing the spread. Of course, they use measures that are not sustainable. That doesn't mean they shouldn't be used, but you cannot rely on them indefinitely. You have to have an economic system that can continue to run to some degree in order to ensure the safety and welfare of your people. So I think we have a historical precedent to show us that we can effectively control the virus even without a vaccine, but not forever. So we need the vaccine together with these preventative measures, with population level public health rationales like masking, like safe space schools and congregate settings. In the US, we've been a horrible model for this. There has been a concept that the vaccine alone is enough. And clearly it's not. You've had tens of thousands, hundreds of thousands of people die after the introduction of the vaccine because we have failed to couple this technology, which is wonderful, with preventative policies. Unfortunately, because of the horrific unequal system of distribution that is incentivized by profit, it's quite plain, by profit of pharmaceutical companies, it's going to be very important that there is support provided for poorer nations in the world to continue to enact preventative measures which do economy alongside provision of the vaccine.
All right, very important points raised there. Reinhart, it was a pleasure having you on the NewsHour.